God, I pray over our discussion tonight that it is just beneficial for those residents in our county, but most importantly, it's edifying to you. God, I pray that you just guide our thoughts and our minds as we come to resolutions tonight. In Jesus' name we pray. Amen.
Let's stand for the pledge of allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We'll now do recognition of the public. I have James Hunter.
For the agenda.
We got to put the agenda. Hold on. Sorry. I was messed that up. I need approval.
So moved. Second.
All in favor?
Aye.
Mr. Hunter?
Yes.
Sorry.
The
Just state your name and address.
Okay, my name's James Hunter. I live at 1004 Harris Drive in Gallatin, Sumner County. I'm here on behalf of the Sumner County Recovery Court, Inc. It's a nonprofit organization specifically set up about 10, 12 years ago to support the county recovery court program. Our bylaws say our job is to raise money, get grants, do whatever we can do to help support the recovery court, because the recovery court actually gets no money from the county to run that program. So they live and die off grants, and that's one purpose of our nonprofit. So we've applied for a grant. We've asked for $100,000 that would buy a van. It would pay for maintenance on the van for a year, I believe, and 2 part-time employees to drive the van. The van would be used to transport people in the program that are working, and they all work. They're required to get a job. We help them get a job, so they're all working. And the van would transport them. The ones that did not have transportation, do not have license, most do not when they first come into the program. And this is early in the morning, late in the evening, just whenever their job is. That's why we need 2 part-time people to do this. Right now, we get a lot of Uber drivers. It's really costly. I don't know if you've used Uber lately, but they have gone sky high. And it really has cut into our budget quite a bit. And this would save us all of that money. It'd be great. And of course, they share rides with each other. Those that do have vehicles have been good about sharing, but a van would be a great asset and help us provide this transportation to and from doctor's appointments, just whatever they need, the ones that don't have that transportation. So I'll be glad to answer any questions. We have others, some staff from the program that can help answer questions if you have any questions about our requests.
Thank you, sir.
Okay, thank you.
Judge Bromley?
My name is Ron Blanton. I live at 103 William Shire Drive in Hendersonville. I'm here twofold tonight. One, I'm here as a parent who lost a child recently, May 2nd, to the opioid addiction issue. It affects people at all levels, all races, all financial backgrounds. It has no barriers. My challenge to you, sitting on this Abatement committee, is whatever you spend any of the money on goes to help people who are caught, not some pie in the sky that has not been tested, that's not been tried, it's just somebody's idea to make something work. My wife and I, who she's on her way here now, I'm sure she'll be here, have suffered for the last 4 years with a teenager and then a young adult in this addiction process. Started out, as most does, by smoking weed, and it progressed quickly from there. So when people talk about marijuana not being a gateway drug, they're lying. I see it every day in my court, but I lived it. So I have a whole different perspective than what somebody who's out never sit behind a desk and scientist or whatever. I see it every day. I lived it for the last 4.5 years. In recent days, I've had conversations with many members of the county commission, most of which had no idea what Recovery Court does. And I think probably some of you on this board do not know what we do in Recovery Court. Recovery Court is targeted for those people who come through the criminal justice system. However, it is far more than that. Because of our program, we have people that contact our Recovery Court on a regular basis who are not charged with any offenses, who are looking for treatment. We help them get that treatment. We provide transportation through our recovery board to get them to and from treatment, even though they have no connection with Recovery Court at all. Through our foundation, we have an intensive outpatient program that's available for every person in this county, not just for people that come through the court system. Numerous times we have employers, because we are fortunate through our Recovery Court program to have key employers throughout the county, Hendersonville, Gallatin, Portland, all throughout the county who employ people that come through our program. They have individuals who are long-term employees of theirs who get hurt on the job, test positive for marijuana or whatever. They send them to us and get them in their intensive outpatient program. We accept insurance through our intensive outpatient program, and it's available to everybody, not just people that come into the program. So I'm telling you this because I want you to understand that when we talk about Recovery Court, the stigma is that we only do, and yes, that is a major part of our focus, is to focus on those individuals who come into our court system who would not be in our system but for their use of drugs. But because of our reputation that Judge Hunter had, Judge Jones had before me, Judge Wheatcraft and Judge Gay, and Judge McCormick and Judge Carter from the mental health side, we have people throughout our county that reach to us on a weekly and daily basis who are not involved in our court system, and we help them. So I wanted you all to understand it's not a targeted piece of the puzzle that Recovery Court is all about. It's much broader, and I would encourage any of you all who want to come to our Recovery Court that sits on this board to come to our Recovery Court on a Monday night for staffing. And you see, come to our offices, see where they work, see what they do on a regular basis. Because it's not just taking care of those in our community who are in the court system. That's a fallacy. We help anybody that comes our way. Thank you.
Okay. Anyone else have a comment? Okay,
Hello, my name is Brian Eakins. I live at 204C George Akins Road up in Westmoreland. I'm also here in support of the Recovery Court of Sumner County application for settlement funding. So I know it says up there transportation, but I want to offer a bigger picture of that. It's not just transportation. What we are delivering is recovery capital to people, right? So speaking to a body of people who understand the need for capital when you're trying to reach a goal, right? Doctor's appointments, treatment appointments, self-help groups, criminal justice requirements, rides to church, right? All of these things are building recovery capital for real people, real residents, right here in Sumner County, that have been so terribly affected by a disease that's propagated by major drug manufacturers. It goes beyond transportation. We're trying to give people the capital that the disease and drug addiction has taken away from them. Because when they come into recovery, they have nothing. They have no way to get anywhere. Most of them have burned every bridge with every family and loved one. They just can't handle it anymore, right? And they have nothing. So when you look up there and you see transportation, that may sound like a short-term intervention, but for everybody to view, instead of just transportation, what we're building is recovery capital. That's good for the individuals, it's good for the community, it's good business for Sumner County.
Anyone else like to comment? Not, we'll close the public recognition. I'd like to move on to approval of the minutes.
So moved.
Can I get the word minutes? Approval of the minutes from March 14th.
So moved.
So moved. Second. All in favor?
Aye.
Okay, and then March 28th, I know it was passed out at the meeting. Everyone had time to review those. And would you like to approve those?
So moved.
Second. All in favor?
Aye.
Okay. Report of the committee chairman, I don't have a report at this time, but I'd like to go to the report of the grant accountant.
At this time, we have spent a total of $36.75 of restricted funding for the sole purpose of advertising in the paper. What our next steps are is to, if you're looking at the agenda, is to adopt a policy for capital projects. After that, this is where it becomes very important. We have the acceptance and discussion of grant applications. The county commissioners will have the vote to say whether or not a grant application is to be accepted for the process or denied. If they're denied, they will not be considered for funding. If they are accepted, they will be considered for funding. The reason being, if they are denied, if a county commissioner makes a motion to move, I do request that you all make a suggestion of why you are denying it. So if I was to say, for example, we're just going to say the city of Hendersonville applied, and I say they have left out a budget. If you want to use that, feel free to use that in your motion to deny. Otherwise, I need a motion to accept. After that is done, the scores will be revealed that you all have sent to me, that have been compiled, and then we will look at the funding aspect. From there, you'll be needing to have a recommendation of grant awards to the budget committee, and then we'll go through the rest of the agenda. For right now, we will be looking for adopt a policy for capital budgets.
So, under new business, we have adopted policy for capital projects which must be located in Sumner County.
That is not in your packet. Basically, it does what it states. County Commissioner has requested that all capital projects must be located in Sumner County. David Lawrence has stated that that would be okay going forward. To look at capital projects, they all must be located in our county. And so the Finance Commission is looking, Finance is looking for you all to either recommend or not recommend a policy that says capital projects must be located in Sumner County for opioid abatement or remediation.
I'd like to make a motion to discuss.
Second.
I'll go first. I don't have an opinion, but I'd like to discuss the idea of some of the things that we have seen have been capital projects mixed with service delivery. So we're pulling that apart here, and we're just talking about capital projects. So I'm assuming, and I'm asking because I don't know, I'm fresh to this too, that we're saying that if somebody came and their capital project and a needs project, that would go together in this policy, or would they be split apart? Because we saw a similar project, so that's why I'm asking.
From the finance standpoint, the way that you're looking at the phrase capital projects must be located in Sumner County, we will use a structure for this example. Any structures, rehabilitation of houses, or anything must be located in Sumner County for Sumner County residents.
So, my question is, if the project, if the person, I'm just throwing this out there, the entity is in Nashville and they want to do a project in Sumner County, are we saying that if it's just in Sumner County, that's okay, even though the company or the 501c3 is in Nashville?
That is correct, yes, ma'am.
So this only applies to buildings and structures, right? We're not saying they can't buy a van from Rutherford County.
Correct.
Okay.
That makes sense. Makes a lot of sense. Gerald,
I'll make a motion to approve.
anyone have a second?
I have a piece of discussion first. I think we're a little behind so-called the 8 ball in creating this policy. We've already got an application out there. We received an application for capital projects outside of Sumner County. So it's, in a sense, I think it sets us up for, conversation because it wasn't clearly stated in our application. So are we going to go forward if that application that we already received is approved and you come in place dated with this new policy?
Well,
Because it'll be a precedent already set at that point.
At this point in time, the application has not been accepted or recommended for funding. My standpoint is this body would have to first debate whether or not to accept it. The application does have a few other issues that have come about. And so that is a discussion that would need to be had for that application period because there is an issue with the application that you have alluded to.
Right, but I guess what I'm to clarify, we didn't state it in the approved when we already approved the application to make it public. We didn't
you
approve.
are correct about that.
Correct.
But it would be, you'd have to look at the overall application too, at this point, not future-wise. If it's a capital project, it would have to be in Sumner County.
Correct.
I think, if I can step in.
Yes, ma'am.
I think we could put an effective date on this.
Going forward.
Yes. So,
Want to make an amendment to our motion to approve this?
if the motion maker doesn't mind, an effective date?
I don't care before, it's open to
I
amendment.
would say effective, do you have a specific date in mind?
I do not, I'm just proposing that might accomplish it.
I would, since we're going to approve applications tonight, not approve them, perhaps we could say tomorrow, going forward from tomorrow, or I'd have to have legal.
You might consider having it moving forward after these applications. I consider that.
Would it not be better to have it, because I don't know, it's a policy, so I don't know how it would work, is there not a period, because we're just a subcommittee,
It would have to be.
so it'd have to go after, actually, I think it would have to go after the June meeting.
Right, commission has to approve the new funding, so we would,
But I'm talking about a policy that directs the funding.
I would say, yeah.
So, would it go from this committee to budget to legislative and then to full commission?
Just put it effective next cycle.
That's what I'm thinking, we would have to roll to July 1
Okay.
to keep it clean.
And you're saying the policy itself is just basically a sentence, it's not like a full policy.
A full policy.
Just want to make sure.
And along that, will you be writing this up? I understand that this one sentence does it all, but will you be writing this up for legislation? Or
So-
for our, we don't really have any real standing roles here.
Right now, we do have policies that have been adopted by the county commission. When the application was approved, we just sent out policies to go forth about how we would proceed. If you were to look later on in your agenda, there is a discussion for future applications, and I will be discussing policies and applications at that point in time, if it is okay.
Okay, so the date, we're talking about next cycle, so we'd have to vote on that, okay? Am I correct? So, Carrie, you wanna make an amendment to,
It was Daryl's motion, I think,
We don't have a second on my motion, so.
I'll second Daryl's motion and make an amendment that we make that effective for the next cycle of application.
All in favor?
Aye.
Good to have a second for the substitute motion, or for the amendment.
Yeah, we need a motion.
Second.
Right. All approval?
Aye.
Okay, so we're at, acceptance and discussion of grant application.
So what I'll be doing is, I'll be reading off each grant application, the project, and if there was an issue that somebody has brought to my attention, then I will make it known to the board. I'm looking for a motion and a second to accept it or to deny acceptance. Application number 1, Mid-Cumberland Human Resource Agency, Building for Wraparound Services. There was discussion that there were not any letters of support from community partners. That comes into effect because $377,000 were from opioid abatement grants from surrounding counties. They did not include any additional information such as an award letter or a contract showing where the $377,000 would be derived from. So there has been a recommendation to actually not accept this application.
So, for reasons stated.
Second. All in favor, Commissioner?
Aye.
This is to reject.
Application number 2, Sumner County Coalition Incorporated for training, awareness, and partnerships.
Time out real quick.
I'm sorry.
Are we just, so if we're going through the current process,
Yes.
eventually we're gonna hit a point where we're quote unquote out of money. So do we just wanna go through them and then talk about?
We're having to accept each one first. I see where you are. We're accepting them.
Got it.
And then after we accept them, you will see, then we're going to approve.
I just wanna make sure we don't get to 7 and like, oh, you're crap out of luck.
Yeah.
We just ran out of money, so.
No, because you all haven't even seen the scores yet. So
Okay, just wanna make sure.
we're on the same page. Sumner County Coalition Incorporated Training, Awareness, and Partnerships. Recommendation is to move forward.
That's for, Commissioner.
Second.
All in favor?
Recovery Court of Sumner County Incorporated, IOP Transportation Services, recommendation to move forward.
So moved. Second.
All approval?
Court-appointed Special Advocate, CASA, to recruit, train, support, and community volunteers. Recommendation to move forward.
So moved. Second.
Approval?
Buffalo Valley Incorporated, to provide 50 recovery opportunities to Sumner County residents. Recommendation to not approve on the contingency of they requested $402,000, which exceeds the amount that was advertised.
Motion not to approve. Second. All in favor?
Next up, Cumberland Heights Foundation provides scholarships for 20 patients in outpatient recovery. Recommendation to move forward.
Second.
Motion to approve.
No, sorry, motion, I'm sorry. Get ahead of myself.
All in favor?
United Neighborhood Health Service at Salvas for staffing. Recommendation to move forward.
Motion to approve. Second. All in favor?
Request for a 5-minute break, please.
5-minute break, please. We're gonna take a break. We are back in session.
In front of you is actually all the information that has been compiled. If you are looking at it at this point in time, all of the applications that have been accepted, should the board want to, can be funded with an additional $92,735.27 remaining per our policy that is to go to Narcan or Naloxone. at a certain point in time. If you're looking at each individual page afterwards, you will see the reviewer number, the score that was given to them, and then any comments or notes that the reviewer made. This was helpful because coming up in a future discussion, we will be discussing some of the changes that need to be made to our application process.
So the first thing would be to talk about the extra funding, is that what we're saying?
I would suggest that the board accept and recommend funding for the applications that were accepted, and then to discuss the $92,735 that is left.
Okay, so, well,
You want 100% approve every single one.
yeah, so we're gonna go ahead and vote to 100% approve the applications that have been approved, and I'll need a motion to approve. Hello?
I'm sorry, it's a lot of information in front of me. I'm just processing.
I need it, Commissioner. Motion to approve the 5 that.
Well, I'll make a motion, but there's some discussion I'd like to have, so I'll make a motion.
Motion second.
So you made a motion to discuss, not to approve.
Yeah.
Discuss.
Just a motion.
Second on the discussion.
Okay. All approval for discussion?
Aye.
Discussion.
Daryl, you want to start?
Yeah, sure, I was, trying to get 9,000 squirrels running around in my head, in the same tree at least. So I guess so we're looking at funding all ask that's been approved, is that what we're looking at doing?
All of the applications that have been accepted, you're looking at fully funding, yes, sir.
And then that leaves $92,000 left over to possibly divvy up.
Divvy up, where would it go?
To the approved entity.
So we could fund them plus some,
Or you could just hold that for the next round.
that's what I was.
Yes, you can hold it for the next round if you would like to do so. There may be other ideas that are out there that if this body wants to discuss or have an idea. I believe that one of those ideas that a commissioner has asked me to entertain or to ask you all about is actually having a table at the Recovery Fest. And so that would actually could potentially come out of this.
Is there not a policy right here already that I'm reading that says if there's funding left over, the committee will either recommend funding to go towards supplies for the county, recommend funding to be placed in the second round for a county project focused on opioid relief? I mean, I thought we already approved this policy.
The policy has been approved, but if you look at the third option that you just read, then we could technically do a project where we can support the Recovery Fest for a table. If this body wants to recommend it, and should the county commission approve it.
How much is the recovery table?
The second round must be in a certain time frame. Is that what you're referring to?
No, the third one, the project.
Recommend funding for projects to build the committee.
What does the
table would be less than $100. But the item with the table is not so much the dollars, it's what's in the table.
so we'd have to have employees to.
Well, or us.
Yeah.
So we could see and get more involved in understanding.
Yeah, I like that. When is it? Do we know? September 8th. Sorry?
September 8th.
September 8th. That's an option, and then, that leaves you $91,900 left.
I suggest we give them more than $100.
Well, that's what I'm asking.
I think it's a donation, yeah.
I think we're getting
Good.
off track.
We can do that
Let's
later.
focus on these and then let's focus on the
Let's
other.
go back to what you were asking about. So, the question is, what can we do with the extra money? And my question.
No, the question is, what are we doing with these right here?
Correct, but what do we
doing withholding for funding then?
Yeah,
No, we have not had that motion on the floor.
no, but yeah, because you asked a question, so
If you wanted to discuss it.
have you any more discussion about what your
Can I
concerns are?
ask a question of recovery court? Just to clarify. You said 100,000 and on here, apparently suspend the rules.
Motion to suspend the rules.
Second.
All in favor?
Aye.
The record you have is correct.
Okay, I just want to make sure there wasn't.
I didn't say 100. We had talked about applying for 100, but when we put everything together, it was the number.
I just want to make sure we're not
Yes,
changing.
no, that's correct.
Okay, good deal.
Motion to come back in.
Just bring it back in. So much.
I mean, I'm fine with fully funding all of these. I don't really
That's a
see
motion?
need not to. So yeah, I'll make a motion to fully fund
I'll second.
all approved
All in favor?
or accepted or whatever term.
Do we all accept, do the commissioners all accept your approval? Okay, we're gonna fund them all 100%. Okay.
So that leaves us 92,000. So, okay. Can we get an update on the holdback money? Quick.
At this time, there's 500,000. There's discussions for potential navigator and other discussions being had. We are looking at having a discussion with you all hopefully in July.
Okay.
And that is where we
I
are.
just want to make sure it's not just sitting out there.
If it's not, the idea would be, as per discussions that have been held previously, we would release it in November.
Could we get a current budget update with the total funds? Where the second drop's hit as well?
The second drop has hit, but that has not been allocated for the budgetary purposes, so we couldn't even spend it if we wanted to. But I will send an email to everybody on the committee saying what has been allocated, what is in the budget, and about the second drop.
Any other questions, concerns? So we approved the 5, and now we have, then we're gonna have to send them to the budget committee. What about the 92,000? When do we put that in there for discussion? I'm sorry, I'm like Robert's rule, not real good at it.
You can do it anytime. If you got a motion.
I have a motion to talk about the $92,000.
Second.
All in favor?
Aye.
Okay, let's talk about it.
I'm not.
Okay, so just to be clear on our options, I think I heard you say we could use it for Narcan.
Yes.
And then that would be just a discussion on how we would distribute it or what organization would or something.
Per the policy, it would stay within the county to help relieve either like the sheriff's office who needs it, 911's to help with their budgets. Otherwise, you could also, it would be purchased from the health department as they were going to our July discussion, trying to find a reduced price or we can get a better price for it, so that way we can put it out there and it would be available for all county departments.
What is your sheriff's department budget for it? How much do you?
We don't have, it went on a specific line for Narcan, it was
What
just
do
supplies.
yeah.
We use it
I
fairly
mean, like
frequently.
20,000, 100,000, I
Oh,
have no idea.
we partner with the Prevention Coalition.
Yeah, the state provides that free.
So.
It's
if you
free.
ask how much
So
we
if
get
it's
for it,
free,
If it's free, but my understanding is that they have not been able to give us a large donation. Is that a correct statement, Megan?
That is, so that's the result that actually helps.
Yeah, I actually work on that project, so if you'd like information, actually, the reason we don't give it out as a book, because it is a prescription medication, it has a shelf life on there.
okay.
So we don't want it to sit and expire, because ultimately we see that happening a lot. So then therefore it's wasted tax dollars. But yeah, at the request, it's free. We provide all first responders ultimately, even to the capacity if y'all might leave behind, we would supply enough for your officers to leave some behind. And that's as well with the health department as well.
Chair, I was thinking because I did a tour of duty, I guess, as a probation officer, why don't we look at supplying some drug screen money to our drug court, recovery court program for detection of illegal substances? That would free up some of that money they could use other places for transportation and other things they may need in the court.
I like that, but is it an option?
If there's an option, if you all do choose to use it for the drug screening, I would need at least 24 hours just to verify with the state to let you all know, number one. And number two, if you do make the motion, I would ask for it to be considered a direct appropriation.
Can we suspend the rules to hear from drug court if that's even an option or a need?
Yeah, let's
Okay,
suspend
good.
the rules.
So moved.
The question about drug testing, you have a grant that provides some drug testing, but it's never enough because we're drug testing either 3 to 4 times a week. We're drug testing for court. So anything that we could get extra for drug testing would be greatly appreciated.
What would be like a monetary number? What kind of number would you look at for assistance paid for help?
Okay, John actually just did that.
Our Sun grant contract came back today, and I need about 30 seconds to pull it up. Email the compliance right before we got here.
Because we ran out of money earlier in the year, our foundation actually gave us some money because they helped support us. And so, they've actually had to buy 2 rounds of drug testing, which was about $2,000. So, we'll get that figure.
How much is a drug test costing you individually?
It depends on which one we're using, but we like to test for everything possible.
Right.
So, was it, they should
That's it.
$750 test, but what happens is if we test them and it's positive, then and they deny any use, we're sending it off to the lab for confirmation. So that's another thing on top of
That
that.
goes to the state for confirmation?
It goes to drug testing labs like Redwood.
Yeah.
Our budget in our large grant, it comes from the Department of Health. Next year, starting July 1 is 40,000. We will probably exceed that in our need. It depends on the foundation of the supplement.
Statistically thinking about that, you're running out, so based on how far into the year you've run out, what kind of number would you be looking for, like 20,000?
It sort of depends on the referrals we get, how many people are in the program. Based on, we're in our largest size right now, based on the number of referrals we've gotten. We're talking how many referrals we get from the DA's office, because they kind of are a gatekeeper. They control the number of people we interview and who we interview. We accept almost everybody we interview, or we refer them out to another agency.
Are you looking at how much per tail?
She's asking after we run out of our grant money before the end of the budget year, how much more do we need to finish out the year? Is that your question?
It's between 10 and 20 is what I anticipate if we keep up the pace we've kept up the last 6 months, which has been our heaviest pace in 15 years I've been here. We're bigger than we've ever been, and we're taking more people than we've ever had.
Just so that you all also know, the county probation, we had a funding arm that was a $1.50 tax that was put on drug testing fees back in the late 1990s and went through to about 2010, and then for whatever reason, it stopped. And so we had, and it stopped because we had like lots and lots of money in there. And so county probation has been drawing off of that to the point that all of a sudden there is no money left in that account.
And they were using the money.
And so we have, we've had to put in our budget this year over $10,000 that we never usually had to ask for just in drug testing kits. Because drug testing kits are, if you'll go back and look at the county probation's budget, we added $10,000 for drug testing, knowing that we're probably, we don't test as much as what they test for in recovery courts because we can't afford them.
Oh my gosh.
Who stopped the?
Yeah, that's what I'm at.
It was stopped by, I'm not sure, the clerk's office stopped it, if it was an agreement they did with the company, but they stopped collecting this money. And so, because the company, it was collected and went straight to the drug testing company. We never saw it, it was a pass-through. It never came into the county. And so, it was taxed, and this tax went to, I'm not sure what the lab was, but they got it, and they had all this money. Judge Hunter may know the name of the lab.
I have,
Oh, yes, that's who it was.
yeah, I have a vague memory of when this happened. We used to order a certain contribution on every drug case to be paid into this fund. May not have been a lot of money on each one, but it went into that certain fund, the clerks kept up with it. Somewhere around the time Ron is talking about, 2010, whatever, the state told us we couldn't do that anymore. You can't order contributions willy-nilly like that just because you want to do that and it helps your program. So we quit doing it. So,
Do you have a question?
No, ma'am, I just have a motion.
I wanted you all to be aware of that.
Thank you, Jeff. Let's come back in. Go ahead.
So you drug test? Yes. Do you need drug test money in jail?
No.
No. Do you drug test or?
We do for employment drug tests, but most of our drug tests with inmates are going through their program.
It goes over, so you don't need any. How do
Is
you
there
get the money?
anything
Yeah.
opioid related?
That's what, Will and I were just talking about.
I guess what Terry and I are trying, we were down here having a conversation, like, could we use this money to offset, maybe
Something.
free up some other general fund budget money?
So, no, I don't think we can use money to offset. We could add some additional tools to the sheriff's office, that don't fight the opioid crimes.
Could we give it, Judge Blanton, you just said you had to put that in your budget, do you propose to the commission?
$10,000 was added to our budget.
So we could take that $10,000, yes. I'm assuming you could offset that.
Or I think from what I'm hearing, they might use that 10,000 and more.
In addition.
Yeah.
Sure, that's what I'm saying.
We're gonna run out of.
No, I don't think we're
$10,000 is
gonna,
gonna go up.
yeah, I don't think we're gonna save the budget.
Well, my
I think we're
question is,
gonna add
can
more.
we go straight to the court with the money though? Is there an issue with that? I'm trying to make sure with giving money to the actual court system, is there an issue with the opioid money?
There's not an issue, however, if you are looking for the direct appropriations, I would ask whoever makes the motion for whatever is given, that you all give me at least 2 months, well, because we'll, future discussion, to be able to verify with the state to make sure that it is a cost that they will approve, so we do not have to come back to the table.
So that would have to come back, is that, it's kind of like a little gray cloud, so we'd have to get
Yeah,
a.
one of those two. I have a question. Do we have to determine, a future for that 92,000 tonight?
No, ma'am, you do not.
So we could ask for, spreadsheets or proposals on how much.
I was gonna make a motion, whatever.
So, so what I'm hearing tonight, I just want to recap. The recovery court's needing money for drug testing, and the, court health system is needing money to help offset their drug testing program. So we're looking at 2 programs that are looking for additional money. So the next question, the next thing I want to ask is that, we have several other entities that have asked for money. Are we going to allot anything left to those other entities as far as helping them out?
What I was listening, I thought it said that it's going to county.
For the 3, it has to go for, as Laura stated, either for Narcan, special projects, and I just lost the 3rd one, but yes, you're looking for county.
So the money, so that money, the $92,000 does not go to, you're confusing me. So read me the 3, what you just read. Read me those 3.
Okay, is it on me already?
Yeah, it's in the policy work office.
Go to very,
Page 19 of the plan.
So the recommended funding goes towards supplies for the county. Example would be Narcan, Sheriff's Department, EMS, Health Department. Recommend, and I guess you could add quarters. Recommend funding be placed in second round or county project focused on opioid relief. Second round must be, note that the second round must be a certain time frame where Sumner County runs the risk of losing any funds. That's a biggie. When is that date?
You have to appropriate it by November.
So, it's either recommend funding goes towards supplies for the county, or to be placed, so really you can't do what they have applied for, the ones that have been approved, you can't actually give money towards that.
Correct.
Am I correct? Okay.
Can I ask, when is our next meeting? I'm
We haven't decided.
Can we, I would like to have time to, think about the 92. I guess a moment ago I asked if we had to choose on the 92, and now I'm asking, do we have to choose which option we're picking tonight?
If I may speak, you know, I try to filter this as best as I can, and that's something I have trouble with. I understand y'all voted not to fund some. I think it's also noteworthy that y'all are holding on to $500,000 that wasn't allocated. I'm not an elected official. I don't have to worry about being reelected.
I'm not worried about that either,
But, well, I'm just stating, the commissioners may be, of why that fund's held back, why the policies didn't state anything prior to the application going live about disqualification and things of that nature. So I just wanted the minutes to state that.
Thank you.
I personally have witnessed 2 of these applicants operating in our county for years now.
Yeah.
And their statistics and numbers are incredible. They have been doing it, they've done so much with so little grant funding forever. I don't want to hold on to it. There are people right now out in our communities dealing with this. We can give this money to them and they can help combat it, right? I see no reason to put that $92,000 back anywhere other than the Recovery Court or the Prevention Coalition. These guys are out doing great work. They've never been accused of doing not enough. Give it to them and watch them fly.
I think that's a great idea, we would have to all agree. What about,
So with that idea, I think then we would have to look at the second round, and we can make it a quick round.
Mm-hmm.
But, and that's where I'm asking, I'm saying, you know, do we have to decide or which way we're gonna go?
I don't get a vote on that.
I know, but
I have a motion,
okay,
whatever.
legal, is there any?
You know, I'm saying he's been trying to do that for quite a bit, so I think he needs to go ahead and do it.
Been told by the chair to stand by, sir, I will yield to the chair.
Okay, what is your motion?
All right, thank you, Madam Chair. So I make a motion to allocate $40,000 to Sumner County Recovery Court, that to be shared with Sumner County Court, whatever division they need to split that up for. I don't think really and truly we need to tie them down to say it's for drug screens, but they need to know and understand that our intent is for that to be for drug screens. If there's something else they need, that they can use that for that. That's my motions for $40,000.
As long as it goes to opioid.
Madam Chair, if I could respectfully finish my statement as you asked me to earlier. The reason why I'm making the motion for $40,000 so the grant writer can do his research and come back at our next meeting and let us know whether or not that's approved, and then we can make that motion to go forward to the budget. So that's why I'm making the ask.
I would ask with the council to amend it just a little bit so I can discuss with Recovery Court about performance metrics where they can spend the money, and I can report it back to the state police.
That's fine, if that's what you need to make sure it complies. That's.
So the motion is an amendment to allow Dustin to do his research?
Well, his original ask was for us to make that motion so he could speak with him to confirm it. So that would, and again, that's my intent, is to make it for $40,000 for Recovery Court, Inc., I believe is what it's called, to be able to use drug screens or as they see fit, anything else that they need.
With the understanding that you give them the information.
Yes,
Okay.
that's my motion. And I have another motion following this.
can we suspend the rules and just ask him if that's his business?
There's no second on the floor yet.
Okay. Oh, I have to second and then ask? I just wanna make sure that's a good number. So,
Well, they've only went over 15 in the last 6 months, so 40.
sounds good?
And if we can come back in 2 months, once our grant writers had discussions with them, and we can amend it at that time if we need to go higher or lower. We just have to do something tonight to give him permission to move.
Dylan second, on favor? 40,000 with research, and then you have a motion, or what, you have a question?
I do, Madam Chair. If we can suspend the rules, I'd like to hear from the Recovery Coalition to see what they have to ask for, that we can maybe able to allocate the other 52, if that's possible.
Yeah, well, we partner with Sumner County Sheriff's Office on Cam2, which is actually starts next week and next week, but it's a yearly thing, so we'll be back around next summer. So we did ask for a little bit of funds in that, but we offset the large majority of it, so if we could get, that cost around $25,000 a year. They offer about 200 kids, they feed them 40 meals, send them home with meals, they do a ton of prevention education, protective factors, meeting with parents and things like that. They provide transportation to and from, so any kid from any side of town can get there. So any more direct funding for that would be a massive bill. So you're looking at $25,000 asking?
I'm just saying, that's about what it costs yearly to put it on. And then Child Safety Day as well. That kind of goes, that's mostly straight. Try to kind of beg for sponsors, but that's we partner with Sheriff's Office on that as well, and we have a booth and there's a bunch of booths that just trying to keep children.
Potentially a stupid question, but why was that not asked for
No, we asked for some.
in just all of this?
Yes.
There's something.
There's some in there, yeah.
But why not the whole amount, I guess is what I'm asking. Like just.
We don't want to be greedy.
Okay, and that's a fair answer, like, that's what I want to make sure. And I feel like that's what this Buffalo Valley did, they wanted to shoot for the moon to hope that they would cut it down or whatever. And so that's a fair answer, I just want to make sure that question's asked.
And if I can interject, one of the items on here from the earlier discussions, it was put in here that only one award per 12 months is in here. So we have another round coming up.
That would be a direct appropriation, that's not an application.
So, but if they need more money, they can apply next time. Is this true?
They can't officially, so it's not.
We need to do some rule changes anyways, right?
Not
I mean, I see that as a problem.
We need to do some rule changes anyways, right?
And that is coming in July when we have our next meeting, hopefully.
Yeah.
Any other, do you have any more questions for the audience?
So, we don't think you're greedy. So why don't you tell us, without being greedy, what would fund the project that you're discussing?
We asked for 100% leadership summit too.
We didn't ask for 100% of leadership summit, which that usually is around 5,000, so that would be 30,000.
I guess what we're asking for is like dream a little bit, and most of
Yeah.
I mean, and I don't know that anybody's ever asked you to do that, so I'm just saying that maybe
Right,
it's
yeah.
hard on the spot to do that, like.
Maybe
check out
say $40,000.
Yeah,
That cover it?
that we could do.
That would give you a buffer?
Yes, ma'am.
We had several strategies throughout the work plan that they could be spread over to
Okay.
work 100% asked for.
So $40,000 would help you cover, and with the understanding that they would have to review that, make sure that it's appropriate. So that's clear, 40,000.
All right, so that's 80.
So we need a motion to approve their app.
We gotta go back under the rules.
Yeah, back here we come.
You need to say something, Judge Blaine?
Yeah, I'd like that $500,000 for recovery court to build us a building, so these people that are not in the attic, suffering, you can't walk up their stairs, it's ADA, it's not ADA approved, we can't take anybody that has, in a wheelchair or disabled, because they can't even get upstairs to these screens, it's ridiculous. If you want to spend your money wisely, you're sitting on $500,000, give it to recovery court. Judge Blaine's not wrong.
I've been up there, I know, I almost killed myself.
That's all I'm gonna ask for the pie, build us a recovery center. We have offices and training facilities, we offer an IOP that's available to everybody in the county, give it to us. I'll ask for it.
Respectfully so, this money is for my condolences, honestly. This money is to combat the opioid epidemic, not to sit here and hold on to it. This is our first round of funds, and we're holding on to half of it. That doesn't paint a good picture, I'm just gonna be honest, and that's my perception, I understand that, but I also serve on 13 other counties.
So, okay, so, Carol, you have a question?
I was going to make a motion, Madam Chair.
Okay, a motion for, we're coming back into session.
Yeah.
Sorry.
All right, so my motion is to allocate $40,000 to, Sumner County Coalition, Inc., whatever that title is that carries through there. Makes that $40,000 allocated there. And then once I'm through with that, Madam Chair, I'd like to fall back in the queue.
The $40,000 motion to Sumner, is there a second?
Second.
All in favor?
Aye.
So that leaves,
with recovery. I'm sorry, I wasn't see that one.
All right, so also, since we're talking about a grant award to the Budget Committee, I would like to, Chair, to entertain a motion of freeing up, the $500,000 that we held back in the first meeting. Go ahead and free that up and bring that to the table.
I would like a motion to discuss that, because we talked about that before, and there was rationale for it.
I made the motion.
Okay. I'd like to make a motion to discuss it. Do I have to get a second first, and then?
Yeah, I got two motions on the floor.
Motion is,
My motion was to free it up and bring it up so we can spend it, the $500,000.
once there's a second to that, you can discuss it. You don't need to have two
She made a motion right after I made a motion, so.
You wouldn't need to have two motions. Once there's a motion to, I guess, approve that, and a
Correct.
second, you can just go ahead and discuss it.
I second discussion.
Okay. So, motion to discuss? A second motion to discuss. So,
So we just,
my question.
you all just do, then.
Well, that's what I think we're just trying to figure out.
What it was,
We just
is
made a motion.
once there's a motion to free up this, and there's a second, there's no other,
You don't vote on it.
you don't vote on it, you
don't
discuss
vote
it.
hands on it up or down.
You can discuss it, then you can vote on it once discussion is closed, once everybody's discussed it.
That's what I was trying to say.
Yes, there's motion and a second, and now there's discussion. Yes.
So, I would like to ask Dustin, we had talked about this in the past, holding on to the $500,000 as a buffer, because we're not guaranteed a lot of the funding. I'm trying to recap what I remember from the conversation. Can you explain that?
So we did hold on to $500,000 for multiple reasons. The first one is, this is our first round grant cycle. We wanted to see what we were going to get, make sure that everything was kosher with our application and how we can move forward. We were laying the foundation. Second one is to look at long-term solutions or long-term partnerships. So what I have done is, behind the scenes, kind of asked people, visited with other areas to see what is actually needed. And in doing so, one of those areas that's in desperate need is the runs to the hospital. You have roughly 227 runs a year to the hospital, not to mention repeat offenders. So what they are looking at is wanting to come to the table to partner with you all to, A, use the $500,000 for seed funding to actually get more money for more than 1.5 or higher, which would eventually allow for, they would be Sumner Regional Hospital. We have also reached out to the Volunteer Behavioral, Sumner County Prevention Coalition, and a few other agencies to look at what an infrastructure would look like to help those that are going into the emergency room, to get them assistance to free up beds, so in case somebody in this room should have a heart attack, stroke, or whatever, that would free up, hopefully, room in the ER for them at that point in time, while also treating those that are needing assistance. Cases, we're hoping to help repeat offenders by hopefully having somebody that is a peer specialist be able to reach out to certain areas. When I was having discussions with some of the rehabilitation areas, I mentioned that they had a navigator in place to reach out to the hospitals. The sad part is those rehabilitation centers could not name the CEO, CFO, or who the emergency room director was. So you do have a disconnect with those agencies. So what we're trying to find out, and my next meeting was on June 14th coming up, is how can we break those barriers to help those people as well as free up bed space in the ER long term.
So my understanding when you had that discussion was there was also some other grants or whatever we could apply for if we held that money back and turn that 500 into 600 or 700 or whatever.
So when I
Is
mentioned
that the proper understanding?
yes, so when I mentioned the 500,000 at the beginning for the 1.5, the state is hopefully in September going to do their second round of funding with the state opioid abatement, and then that 500,000 will be used saying we were wanting to do this bigger project. Here's 500,000 that we have set aside to bring in 1.5 million to make that project last longer and help out those entities that are partnering together to actually have a long-term infrastructure plan.
If I may, I'm sorry, go ahead.
And actually, back to what Judge Blanton has asked us all for, I've been hammering Justin if we could get that state grant for the recovery center, and then we need this in action. So that's one of the reasons I'm not in favor of like laying it out. I want to hear more options. I've also spoke to other counties, and they advised me, they're a little bit ahead of us, and they advised that, step into it slow and, go forward, not all at once, because you don't want to jump in. So that's where I'm at.
So a couple things. The state already funds a navigator for Sumner Regional. The reason that it hasn't necessarily been effective is because there's been consistent turnover within Sumner Regional's administration. Number two, I asked the question about the second drop because yes, we are holding on to 500,000, or we withheld that from applicants, knowing that the second drop's already there. So really, if we had the total budget amount, we're probably sitting on close to 1.5 million. Looking at match funds, the state OAC does not require match for their funds. So the fourth thing, realistically, holding on to something for match, yeah, that's probably a good idea. But 500,000, that's a little overboard.
Sure.
I agree wholeheartedly with Judge Blanton, and I don't want to wait and slow roll it. And I mean, the money is there for a specific purpose. Let's put it out there. The county has a building right now. This is my personal recommendation. Children and People building behind the Gallatin CID annex on Southwater.
To make that into a recovery center?
Give that to the drug court. I mean, you guys have all seen it, right? They need space. Use that $500,000. That would be an allowable expense, right?
I would have to double check. As Judge Blanton has said, they do have opioids, but I do need a breakdown because the majority of the funds have to be spent for breakdown. Opioids, we do know that there is DUIs and everything else, so I would need to get together with Judge Blanton and Tracy, number one. Number two, even though we do give them the money, I would request that it not go before the county commission until after Gen Ops approves it, because they would be the ones that would decide it.
It would have to go.
So we would need to make sure that all of those avenues are covered before the funds are released.
Right.
And along with that, with Gen Ops, I have looked at the building. I don't know how much the cost is because of potential materials in there. So before I would want to set it aside, I'd want to see it, like a little bit more shovel ready to what that would be. But I think what Judge Blanton is on, he has full plans for a full-blown youth facility.
Then let's do it.
We just need to walk forward and see if we can get into those state grants in September.
So, I'm sorry. Here, I didn't see your hand.
Go ahead, sir.
No, I didn't see your hand.
Go ahead.
Go ahead. I'm gonna retract my second, which means he's probably gonna die. And the reason I say that is because I would love to see this 500 turn into whatever. I've always thought of new facilities for the recovery corridor would be great. And I think that, and Will, I love your passion, but I think you hear these answers and no. And it's not a no, it's just a not right now. And I understand it is a lot of money. It's more money than I will ever see in my bank account. But I would love to see, I know I've also sat in the budget process and heard how we literally can't pay our people because we're struggling on the financial side unless we raise taxes. So if, in my mind, if I can turn this $5 into $10, then that's what I want to do. So I'm going to retract my second to release it and hold on until we get to the next round of funding. Let's go through, figure out what we can match. I don't want to use that building. I want to get a total new building because I'm with her. I'm afraid we're putting Band-Aids on something, and yes, they're going to be ecstatic because it's better than what they have, but I think we can do better. And I think our county deserves better at this point.
You know, and I respect your opinion, but you know, there's lives lost to this money. I mean,
I don't know that
we heard
convince you.
We heard one
and I don't
tonight.
think you're ever going to convince anybody else. So I think
Most of these funds are also restricted funds. That's the thing that needs to be understood.
So, right now then,
Daryl, I think, had his hand up, and I took it.
If he took the second away, I don't think there's any discussion, is it legal?
this can be brought back once we know what money is going to be coming in. Good.
So, here's where I think I'll just say it. This is where I think we're missing the boat. This is a subcommittee. We have to give Dustin permission to go and get all these artifacts and bring it back to this committee before this committee can say, yeah, go to budget. Right now, we're not even saying, yeah, we want to even look at using $500,000 on 6 months from now or 2 years from now, knowing that we could have $1.5 million sitting there already on the return. I don't think that we're doing us a favor by holding on to $500,000 by giving him permission to go and see what he can do, by going and talk to drug court, by going and looking to buy a piece of grass from the Board of Education until this subcommittee says, yeah, we're willing to appropriate $500,000. Please go forward. We're tying his hands to do his job.
So I think those conversations.
I prefer to have those conversations with those people. I have open relations with drug court, as Tracy can tell you, as well as Sumner County Coalition. So I do have those conversations going on about the larger projects, except for Tracy with the larger project right now. Right now, we're focusing on the ER component. But yeah, my door is always open to have those conversations.
Because I don't think anybody's goal is to have this sit in the bank account.
But if we don't, my opinion is, and I'm no legal advisor or even trying to play one, but if we don't give him permission to say, yes, we're looking at allocating this $500,000, it's just sitting. We're not able to move anything forward.
But I thought you said that we were leaving that there to get like he said, $5 to get $10.
Well, it's already 1.5 from 500 if it's by the second drop, see it?
Yeah, that 500 also has a timestamp sticker on it already.
It's just like the ARPA
So,
funds.
and I think that the non-restricted, we're not collecting interest for drugs, but for the restricted, the interest is coming right back in, and that's money that we're piling on top of this at about 6%. So it's not like we're losing anything, and we're talking here about a month, or 2 months, or 4 months. So I'm not quite sure what all the push is when we have a good project that we're looking at, and we want to look at state funding and analyze. So I don't know what the big push is.
Well, I'll push back again. I don't see how, and I'll try to say this as calm as I can, but I don't see how you can say we're not losing anything when we've got paramedics running emergency traffic trying to get somebody before the heart stops.
Okay.
We're losing stuff. It's bad to say that it happens when we've got the funds that can prevent one life being lost in this county in our jail or on the road.
I think Judge Blanton spoke on that.
I'd like to ask the board for this as an opportunity.
That's my motion.
As right now,
Was the first one.
Hang on.
right now, I have focused on one area. What I would propose is for me to work with Tracy over Sumner County, with drug court, if that is okay with her, and then come to you all with 2 proposals before November. That way you have both, you would have all the financial statements, and you all at that point in time could maybe fund both, or maybe none, or one, if that is okay with this board.
But if we don't get a motion in a second, you can't do that.
So let's be
I'll
able
redo my motion. Second.
So the motion is for Dustin to explore options, or only options in these 2 lines?
So, yes, my original motion was to move the 500,000 over, and then, so he can take and go to recovery court and get ideas of how they can spend it and how they can utilize it, and bring those back to us with how they can utilize it, and he can research with the state to make sure that lines up with the allocation guidelines set from the state.
I would also like to have the caveat of working with Tracy on getting additional funding from the state to build a new building, so that'd be an option that Judge Planton wants to pursue, as well as.
It could be a dual partnership. They could apply for grants, or we could have our.
Daryl, you're not saying you want to write a check for $500,000.
No, but we have.
That was my initial understanding, which is why we're tracking this.
No, we have
You're
to.
saying you want to figure out what are options out there.
We have to give permission that we're willing to, it's kind of like earmarked. We're willing to say that this is what we want to do if it lines up and this is check mark, just like we did on the 40,000.
And Dustin, I think what you're hearing from me, or at least what I'm hearing, I'm not going to speak for everybody else, is everybody has a heart to get them out of all this stuff.
Yes.
But, okay.
So I will bring two options in July, let you know the status of both options.
Provided the second one passes, we need to take the vote.
Yeah, I'm sorry.
So we had a motion to approve, we had a second.
So, and again, I just want to clarify, because I thought we were going to look at the money. So this is just a proposal for Dustin to look at these two lines, no other lines, or there's three lines now.
Two lines, one line being with Regional Hospital, one line being with the courts, and then.
Like a recovery building.
Like a recovery building.
Okay.
And then also provide the financials of where we are and what we hopefully will be in 2 years out, because we do know funds are decreasing.
Because I do have a question about, I'm not at all opposed to the recovery program that Doug does one. I'm not, but I understand also that there's inside that building is going to have to be a lot of doctors, nurses, people, all that kind of beds, all that kind of stuff. So the real cost of that is something that, So you would have to think about what, that is something I have in the back of my head, is that I don't want to lose the idea of having it, because when it goes from here to budget, they're going, wait a minute, I'm just looking at the big picture. Yeah. So, anyway, so you have a question?
I do. Anyway, or comment.
We have to still vote on this, so.
Yeah.
I'll suspend the rules for this, so. Go ahead.
What I was going to say, you're talking about two different programs here.
That's what I thought.
We're trying to we're in a crowded space, and we do, you're right, if we move the children or people just like it is, we'd probably be ecstatic. I mean, just we have more room. But what Judge Blanton is talking about is the facility, that's another big, huge plan, and that's our goal, but we've already outgrown the space we're in, so it's two different.
Correct.
So for recovery court, it's two different requests, I guess you would say, because we got the space we're in, it's too small to even grow anymore. Even as
I'm just going to speak for me. I would love to, and this is my banker coming in. I would love this if you could get two proposals, like, hey, this is my dream budget, and this is the next step from where we are now. And let's see, because what I don't want to do is turn this down just because we can't. I don't want to say yes to this and without being able to know if we could have done this anyway, or vice versa. Like, if we've got the money and you can dream to do the full facility, like, and it's $1 million, I'm just going to throw money out there. Like, we may have $1 million that we could do that. Like, I think, and that's what I was getting to with her earlier. Like, it's hard to dream, and I get that. Like, I've worked in nonprofit world before. It is, you try to make 5 pennies last 5 years. Like, I get that. But if you could bring both, I would love that, because maybe we could do the big one, or we could say, okay, like, at least this is better than nothing.
And I appreciate that. I do. Thank you. I just have to find the will here. That money, I thought that money was already supposed to be dispersed out, but there's a lot I don't know. But and I understand also Justin's hopefully trying to network with the health department and the hospital, and anywhere we can save lives. That's what all of us that sit here want to do. We got a whole good crisis, and everybody in the Sumner County Recovery Court program, in our IOP program, you don't just get a DUI for alcohol anymore. It's opiate related. They're all polysubstance. Nobody is using one drug anymore.
So we have a motion still on the floor.
And can I, while we're still out, can I ask you a question? So with the building, the Children or People building, can you move into it without remodeling it? Because that's money that we could like put over on the new, you know what I'm saying? It's the asbestos that worries me, because that's just such a big chunk of money that we could move into a new project. If it
would have to be.
It would have to be done.
It would definitely have to be.
I will support Tracy on this statement, because one of the first things I did, as the board allowed me to, I was able to tour some of the areas with Commissioner Klein. We did look at the people, Children or People building, and what was unique about it is, yes, you're right, it does need to be rehab, number one. And number two, there was also somebody that had moved in on the side, and we didn't know who had moved in.
I heard about that.
So if they are wanting to pursue it, then we need to make sure that everything is done appropriately to help protect the apartments so they can move in there.
Then, we could be back in session.
Rather than come back.
You're getting a lot of new space. Is there any way that Recovery Court could hold on to some of that until we could maybe figure out if there's a new building in the future to save on that cost of remodeling? You know what I'm saying?
Temporarily?
Yeah, temporarily.
Yeah, I mean,
And
we're not
until we
working
could if we could figure it out, you know, if they could have a space to run until we could figure out if there is a bigger option in the future. And then if there is, we got construction time, we're looking for like temporary being like 2 years.
Point of order, Madam Chairman, I'm sorry, we're talking about construction scopes, we're just trying to give the man permission to even go talk to him and see if it's an idea. So,
we
if we could reel it back.
Yeah, we'll back to session, so anyway, so we have a motion again. From you, and we have a second. Are we gonna vote to allow them to go through what we need to do with due diligence?
Aye.
Aye.
Aye. Thanks for the discussion. I like it. Okay.
Madam Chair, do we still want to consider the other 52,000 that's out there?
Sorry, I thought we
Yeah,
did
12,000.
12,000, sorry, my math is bad.
12,000, yeah, I mean, there's,
Or do we want to roll it?
May I make a recommendation? At this point in time, you are allowed to withhold 20% should this body recommend the full amount for contingency use, so that way, in case anybody who has a project that goes over budget, then you could offer a grant amendment to them, contingent upon the funding. So with the money left over, I would recommend at this point in time to hold those funds back, and I would also ask for a point of clarification on recovery fest, please.
I suggest you give them $5,000. For those that ain't never been to Recovery Fest, I encourage all y'all to come and see it and maybe get to see the recovery
I'll make
community.
the motion. I've been the last 2 years to Recovery Fest. And I'll make the motion for $5,000 donation.
Second.
Aye.
yeah, we have been to things, so we can't do stuff like that, so.
I missed y'all, y'all should come see it, there this year for sure. I hand out naloxone to everybody, cooked hamburgers, hot dogs, free.
So, we got $5,000 out, and we're gonna, we want to reserve the rest, put it back in reserve.
I'll make a motion to put the rest in reserve.
$7,000, am I right? Here we go.
So, recommendation both, and I can't agree to that. $7,735.27.
I make a motion to put it in reserve.
Second.
All in favor? Aye. Okay, good with that. And now, question, and maybe, I'm not, these new allocations with will be added together, and then it goes to budget, correct? Okay, so instead of, recovery court at 85,000, you add 40,000? $125,439.
We would be looking at two distinct, grant contracts. One that would state it's a, direct appropriation. That way we know nothing had been filed for a grant application. And then we would ask for one that would be strictly for a grant application. That way we can keep performance metrics separate for this.
Okay, so these separate, okay. So did we just make a motion to forward it to budget?
We just, I think we just did, but just so I'm understanding, and I think I'm tracking, the 40, we haven't allocated it, correct? So it's only,
Sumner and recovery.
The motion, according to my notes I was taken, you've asked me to allocate. However, I need to verify with the state and report back to you in July if appropriation can occur.
correct. So the only appropriations that we've made is the 80-something thousand that we go in the budget for June,
Correct.
which is the appropriation of all grants that's in the top. So that 40 and then the 40 and the 7,
No, the 5.
5. We'll have to come back to for July.
$308,887.50 will be going to budgets with recommendation, and there will be a note attached saying that we are looking at direct appropriations at this point in time to the tune of $85,000, contingent upon what the state says.
Okay.
So if can we go ahead and send the recovery fest numbers to budget so that it gets over to them? Because I don't know if we'll have enough time if we wait till July, and then we have to go through the cycle, because it has to go to budget, and then it'll have to go to commission. It's just a long process.
And it's in September? September 8th.
I'm going to put a notation to the county commission if state approves.
You can find that out tomorrow.
Yeah, I can find that one out. That one's not a problem.
Next item?
Next item. We have a discussion of vacancies. Right now, we have, a vacancy, one vacancy. Our other person, Lori, had to, withdraw. So we have a vacant position. I did talk to someone the other day about, he's a, nurse practitioner, and has been one for a very long time, and he said he'd be interested, but I haven't gone any further than that. So I'm wondering, we need to talk about filling that position. So do you all have any ideas of people that you might like to have on there? Would you like another medical person, or would you like just a average, someone in the administrative that has knowledge?
Can we just open it up for people to send you, the chairman, their application? Yeah, because we don't know who might want it. I don't want to say, we only want, this type of,
I
know who
like
might
that
want.
anyway. So yeah, I don't mind taking the, so if I do that, then I have to bring it back to you all to look at the resume.
You could. No, I think you have to go back to budget, because budget chair gets to decide who's on here.
Yeah.
Budget chooses.
Yeah, they're the ones.
You could get them and organize them and
Send them to Matt and let him know. So, yeah, that's fine. So if you have anybody you know, or, would like to be on our committee, send me your person's bio and we'll send it to Matt. See what they do. Okay? You all approve that? I think that's a good way to do it anyway. Timeline of events for the remainder of the year.
If you would turn your package to page 25, please. In order to try to keep true to my word about not meeting every month, this is a proposed itinerary. After discussions with legal and looking at schedules, it'd be nice to have a set date and time. So we are looking at roughly the first Thursday of the month at 6 p.m. If there is a holiday, such as July 4th, that is coming up, then it would be moved to the following Thursday. Looking at the meeting schedule at this point in time, there would be no reason for the board to meet in June because your recommendations are going to the county commission. I am to attend the Murfreesboro Opioid Seminar, and I have been asked by Emergency Communications to attend their 911 meeting. In July, contracts are to go out to those who have been recommended, whose projects have been recommended for award pending County Commission approval. The board will meet to have a discussion of the revised applications that I'm working on, as well as additional questions, and there is potential for financial limitations as we see our funds slowly decrease. So we need to start looking at some of the options that we want to do or to put into place. Whether it's to cap the amounts, which you may or may not be for, or whether maybe to target certain areas of the county, because 911 will be able to hopefully give us an OD map contingent upon what the meeting comes about in June. In September, I'm sorry, July 11th. Sorry, 5:30. So it'd be July 11th at 5:30. In August, we would not be meeting. In September, it would be Thursday the 5th at 5:30.
Is that Labor Day kind of, it's Labor Day?
What do we just say, August? October?
September.
Okay.
At that point in time, we would be going over the revisions that are discussed in July, recommend application dates, and then apply for safe funds, and to assist those who are here that may want a letter of recommendation to apply for safe funds. In October, it's the first time I'll receive performance metrics from those that have been awarded funds. Reimbursement is to occur to those entities, and I am to report to the states how we are spending our money and where the performance metrics are going. In November, the board will meet again to review the reimbursement and performance metrics that I received in October, and then we would look at having our next round of grant applications, maybe to last for 4 weeks. So in November, that would be November the 7th at 5:30. In December, the board, this would happen outside the meeting, to review the applications, and a new policy may kick in, which we will discuss in July. Just to let you know, the new policy is you would have 2 weeks to review, do a brief review. If there are any questions that need to be asked of an entity of why they've done something, since we did not have that as a go-around, you would give me those questions. I would turn around, give it to the applicants who have applied, give them a week to respond, and then I would forward you back the answer, so that way you know exactly where they are headed. And then in January, it would be January 2nd at 5:30.
Can we roll that during mine? Sorry. Is that what you just said? Yeah.
So January the 9th at 5:30. That way we all have a set date and everybody knows what is occurring. So I'd ask for a motion. I'm sorry, I took over Mary's role. My apologies.
All there? Discussion of future applications.
So for future applications coming in July, working with legal on revamping our application. Instead of having it in bulk, there will be 4 distinct sections for them to approve. There will be character limits, and instead of asking or requiring the attachments to be included at the end, where it says there's that financial section, they would answer the financial questions and then attach it following, so that way it's all fluid in one area. So there is discussions being had, and that will be presented to you in July.
Motion adjourned.
I think Dustin mentioned it, MTSU, in collaboration with Smart Initiatives, having, council board members for the opioid meeting on June 7th. It's open, it's a closed meeting, but open to board members to attend. I can email you Jessica the invite, or she can distribute that.
Sure.
I would love to come, but I gotta speak to an attorney on myself.